Hello everyone, I'm Dr. Wu. I'm a pediatrician from the pediatric department of the first affiliated hospital of Shantou University Medical College. We are going to discuss nutrition and nutritional disorders. Now, let's firstly talk about the nutrition and feeding healthy infants. Nutrition refers to the entire process by which the human body obtains and uses food to sustain life activities. Why is nutrition particularly important in childhood? Because the children have to grow, relying more on nutrition. The nutrients we require are following: energy, macronutrients, micronutrients, and other dietary components. Macronutrients include protein, fats, and carbohydrates. Micronutrients include vitamins and minerals. Other dietary components are mainly dietary fibers and water. Let's discuss energy. A child's energy requirement consists of 5 components: basal metabolism, growth need, physical activities, thermic effect of digestion, and excretion. The younger the age, the higher the basal metabolic rates and the energy for this part. The energy for growth and development is specific and unique to childhood and is proportional to the growth rate. 100 kilocalories per kilo body weight per day is needed for children up to 1 year of age. After that, there is a 10 kilocalories per kilo reduction for every 3-year increase in age. Macronutrients include the 3 energy supplying substances: protein, fat, and carbohydrates. Protein is vital for growth and development. In addition to this, protein can also supply energy of 4 kilocalories per gram. Daily protein supply accounts for 8 to 15% of the energy requirement. The recommended protein intake for infants under 1 year is 1.5 to 3 grams per kilo per day. For the rapid growth in childhood, appropriate high-quality protein supply is needed, mainly from animals and soy. Fat is the most calorically dense macronutrient. In addition to being energy-dense, fat provides essential fatty acid and plays structural and functional role as precursor for cell membranes and solvent for fat-soluble vitamins. I hope you know what they are. For infants, human milk or formula are the major dietary source of fat, whereas older children get fat from animal products and vegetable oil. Recommended fat intake is 4 to 6 grams per kilo per day in infancy and 2 to 3 grams per kilo per day over 6 years. The fatty acid that the human body needs but cannot synthesize on its own are essential fatty acids, mainly obtained from vegetable oil. Breast milk is rich in essential fatty acid. Carbohydrates consist of monosaccharide, the glucose, disaccharide, the lactose, and polysaccharide, the starch, and other primary source of energy supply. The carbohydrate supply is 10 to 12 grams per kilo per day for infants and 12 to 15 grams per kilo per day for children. Due to lack of amylase in the first 3 months, the source of carbohydrates for small babies is lactose in breast milk and formula milk. Let's look at additional nutrients. Micronutrients include minerals and vitamins. Minerals include constant elements such as sodium, potassium, calcium, and phosphorus, and trace elements such as iron and zinc. Vitamins include water-soluble and fat-soluble vitamins. Other nutrients. What are other nutrients? Dietary fiber mainly comes from vegetables and fluid. Water is also an essential nutrient. The younger the age, the more water they need. 150 mol per kilo per day for babies under 1 year and 25 ml per kilo decrease every 3 years. In summary, energy is primarily for the growth and development of child. So the most important thing in that arrangement is energy supply, followed by protein supply. We have to ensure a balanced diet, otherwise a nutritional disorder will occur. Next, let's talk about feeding method during infancy, including breastfeeding and formula feeding. Breastfeeding is the most recommended feeding method. The WHO recommends exclusive breastfeeding for 6 months and continuing breastfeeding up to 24 months. Human milk composition changes during the postpartum period, including colostrum, transitional milk, and mature milk. Colostrum is produced within 4 to 5 days after delivery and is yellow, dense in appearance, small in amount, containing more globulins and less fat, and rich in antibodies. We should ensure that newborns can take colostrum, which is very important for growth and development. 5 to 14 days, we have transitional milk. After 14 days, mature milk. Mature milk contains all nutrients the newborn needs, and will go into detail next. What are the reasons for recommending breastfeeding as the preferred feeding method during infancy? Because breastfeeding can benefit infants as well as their mother. Breast milk contains more whey protein, is rich in unsaturated essential fatty acid, high in lactose for more energy supply. Breast milk provides an appropriate calcium to phosphorus ratio of 2 to 1 for better calcium absorption. Breast milk is not very high in iron, but is more readily absorbed than formula. It's good for prevention of iron deficiency. Breast milk is rich of immune substances such as secretory IgA, leukocytes, lysozyme, lactoferritin, oligosaccharide, etc., which can protect the body from infectious disease. In addition to being beneficial to the baby, breast milk can also benefit the mother. Successful breastfeeding can promote mother-child bonding. It promotes postpartum recovery and reduces the incidence of breast and uterine cancer. It's economical, convenient, and the best way of feeding infant. Formula feeding. Infant cannot be breastfed for various reasons, can use milk products from cows or goats, etc., which is formula feeding. Fresh or unmodified cow's milk is unsuitable for infants because it doesn't match infants' nutritional need. There are various types of infant formula available in ready-to-use, concentrated liquid, or mostly powder forms. Unless the child has dietary protein sensitivity or an underlying metabolic disorders, cow's milk protein formulae are commonly used for all ages. The formula is modified from milk to make the integrant as close as possible to breast milk and more suitable for the baby's digestive and kidney function, including less casein, fewer in organic salts, and fortified with vitamins and iron. Then the caloric supply of formula milk is close to that of human milk, which provides about 67 kilocalories of energy per 100 ml. So, how do we develop a feeding plan for our baby? For example, a 3-month-old baby weighing 5 kg, he needs 750 ml of water, which we will give as formula. 750 ml formula will supply adequate calories. The daily formula volume can be divided into 6 to 8 times. Normally, neither breastfed or formula-fed infants require additional water. The timely introduction of complementary foods, including solid and semi-solid, during infancy is necessary to enable the transition from milk feeding to other table food and is important to nutritional and developmental reasons. Based upon physiological needs and neurodevelopmental maturation, complementary foods are optimally introduced between 4 and 6 months of age, when the infant is able to sit. Complementary foods are added to supply relative nutrient deficiency in breast milk, help to train the infant to chew and swallow. Early introduction may cause overfeeding and food allergy. Delayed introduction may lead to undernutrition or resistance to complementary food, and then difficult feeding. Gradually introduce complementary food according to the physiological state of the baby. First, the cereal, pureed or mashed vegetables, and then chopped meat and fish. Okay, today we have simply introduced the nutrition and feeding infant. Do you all feel hungry now? Okay, that's all for today. Thank you.